Now that we know what is complex high-risk interventional procedure, which we called a chip, then we should also know how the chip should be safely done. It is normally if a patient has a blockage in one of the vessels with pumping function being normal, then straightforward that procedure can be done under cath lab through radial route without much of any problem, without much of help or support to heart pumping. But suppose a patient comes very late, heart pumping gets damaged, or the disease in the arteries is very complex, complicated like left main, bifurcation or triple vessel disease, where you need a long time in the cath lab. That time sometimes the patients become unstable and the patients become ischemic and the blood pressure tends to fluctuate, fall, and sometimes patients could arrest on the table. So to prevent such, what we now introduce is called as a protected PCI. That means we are doing percutaneous coronary intervention or stenting with a protection by the help of support devices. Previously we used to do intra-aortic balloon pump, but now it is found to be less useful, and more high-end devices like Impella and then sometimes ECMO devices are being used in the cath lab to help do the procedure more safely. That is why we are protecting the patient and protecting the procedure during the procedure with high-risk procedures by using a small pump called Impella, which will be taken from the femoral artery groin into the LV, where the small pump motor gets the blood, ejects the blood out of the heart. So heart normally pumps the blood which gets out, but here heart is already damaged, not able to pump. That pumping function is done by a small motorized device called Impella, which gets the blood outside into the aorta, thereby it gets perfused to all the parts of the body. So transiently, if you are doing procedures to the heart, if the heart beating gets affected, still during that time this small motor which does the pumping function of the heart. That's how all the perfusion of the organs gets affected. That's how there's less incidence of kidney problems, others happening with this protected PCI. Usage of supporting device like Impella during PCI is what we call as protected PCI.